Hi there again. I'm here with Dr. Aaron Oxenreider, who specializes in wellness care and has been studying health and wellness since 1995. Today, we're here to talk about his latest report on kids and cholesterol medication. Dr. Aaron, why are children taking cholesterol medication?
Again, as with all diseases now we're seeing, it's lifestyle related. I mean, as we talked about it in the last segment, it's not a genetic issue. It's a lifestyle issue. The diet now is just terrible. The insulin resistance in kids is rising, which drives cholesterol production. So again, they're looking to treat a symptom and not get to the cause, which is really disturbing, especially in kids.
Okay, now I'm hearing from a lot of people when I talk with them that genetics say, or it runs in my family, that I have high cholesterol. Can you address that? Is that accurate?
It's not accurate to the degree that people think it is. The research shows that about 1 in 500 have a genetic cholesterol issue, which is about 0.2%. That comes nowhere close to explaining the level of high cholesterol we're seeing in our nation today.
Okay, so what if somebody has genetic cholesterol issues, what kind of cholesterol readings would they be looking at?
500, 600, 1100, I mean just dramatic cholesterol issues, not 350, 250, even in the 400s. We're talking very extreme level.
Is high cholesterol something we should expect to see more of in the future?
Absolutely. As you know, more and more people are beginning to get overweight. They said that in 15 years, 75% of our population is going to be obese. Now, cholesterol is directly related to insulin. Obesity and insulin are directly related. So as that starts to increase, yes, we'll see a dramatic rise in the level of cholesterol unless we start doing some lifestyle intervention.
Oh, that's kind of scary. Tell me what does cholesterol actually do in the body, and why is it so good or so bad?
I'm glad you asked that because most people think cholesterol is bad, and that's what they've been conditioned to think. Cholesterol is actually natural. It's made by the body. About 75% of it is made by your own liver because you need it to be healthy. It creates your stress hormones to deal with the stressful environment. If your cholesterol is too low, especially if they do it artificially, you may be prone to depression. Same thing now what we're seeing with people on the statin drugs, which in my other report, Sex, Lies, and Cholesterol, we know that the LDL cholesterol directly carries the cholesterol to the gonads to be produced into sex hormones. Again, you reduce that cholesterol artificially, no transportation of the cholesterol, and we're seeing erectile dysfunction and other sexually related diseases.
That doesn't sound good either.
No, it doesn't.
So it sounds like we need cholesterol. What is bad about cholesterol that's causing problems?
Well, what's bad about cholesterol is when it becomes oxidized. Now, oxidation makes things sticky, so cholesterol itself isn't bad. But when that cholesterol becomes oxidized, which happens through poor diet, environmental pollution, kind of the pollution and the lifestyle that we're involved with today, your oxidation goes up. That's what makes the cholesterol dangerous.
Okay.
Because as you know, and as I've seen in many studies, people who are on cholesterol medication and have normal levels are just as likely to die as somebody without medication.
And I also want to know, what can you do to make the cholesterol in your body, quote unquote, healthy again?
Sure. That's a great question. What you really need to do is start addressing the lifestyle issues that cause that, such as the insulin resistance from poor diets high in sugar, soda, refined processed foods. Once you start to reduce those and increase the exercise, you'll see dramatic decrease in the cholesterol, to a natural level that's going to keep you healthy.
If I can convert or repair the cholesterol, how long does a process like that usually take?
It's different for how proactive somebody will be in their treatment. Now, usually treatments are diet modification and exercise, and in just 3 months, we've seen people who have been diagnosed with high cholesterol come down to levels that would be considered medically normal. So 3 to 6 months. Cholesterol testing is very readily available. We actually do it here in our office as well. But to figure out if you have oxidative stress, you need a functional medicine assessment. It shows us if your oxidative stress is bad, moderate, severe, so we can figure out exactly what your risk factor would be for that sticky oxidized cholesterol.
How does it compare if we treat cholesterol through the traditional medical model, medication and things of that nature? How does that compare as far as time and cost, and does that help us get better?
It doesn't help us get better. I like to say if a drug actually heals, then why are you on it for life? The cost is actually quite a bit more to be on a cholesterol medication. I've seen it cost about $1,000 to $1,800 a year to be on a cholesterol medication, and you're typically on that 20, 30, 40 years, basically your whole lifetime, especially now with the kids trying to be on it. To correct it naturally with the functional medicine assessment, the dietary changes, it could be between $500 to $1,200 to $1,900. So it's actually a savings of probably around $38,000, $40,000 over your lifetime.
Well, that sounds good, and I'm probably going to feel better too.
Absolutely.
Now, have you run into any patients who have been kind of victims of high cholesterol or the oxidized cholesterol that you're saying is bad?
We actually have, but we didn't know how to figure out what their risk was until we had that functional medicine testing. So now we have patients that come in that have cholesterol issues or normal cholesterol, and we're able to give them their true risk based on their functional medicine. With the kids, the problem with it is because it interferes with your sex hormones, we have no clue how this is going to affect them during development, which is a major problem. And being that's a lifestyle issue, if you're really concerned about the health of your children, which I am, you need to correct the cause, not try and put them on a drug for life.
Do you have a pretty good compliance? Are most people able to integrate the changes that you're asking them to make?
They are, because people are really so far from what they think they need to do. I mean, they've read diet books and they look at low-fat foods and think they're doing the right thing, but nobody's really taught them how. We found that if they follow just 70% of what we recommend, they're going to get a 90% success rate.
That's fantastic. Well, thank you again for meeting with us and talking with us, and we look forward to seeing you next time.
Thank you.